A lot of HCAs, a lot of medical staff are so passionate about what they do, but it's impossible to get any further. However, the nursing associate role come in and it was like winning the lottery. Everything's possible. You can work, study, become qualified. It's inspiring staff that are already in the NHS to make their skills better, that they are needed, that they are valued. My trust, Nottinghamshire Healthcare NHS Trust, has supported nursing associates the whole way.
I think if the NA role didn't exist, we would still be looking for the answer. So we know that we're struggling to get registered nurses, and we know that we need to find new ways of working to sort of drive services forward. The role is really interesting because it kind of sits in the middle of everything.
It does bridge the gap between mental health and healthcare. If you've got a nursing associate who's been trained both medically with mental health or learning disabilities, then bringing those all in, you can care on different aspects. So you can deal with the patient and their mental health. Then if they become poorly, you can recognise those signs. You can flag them up to your nurse in charge.
But you're there to enhance the service, not to remove it from somebody else. You know, there is always a need for registered nurses. We need registered nurses, that is still the case now, but it sort of adds something different. Notts Healthcare are looking at what we can do differently, and it just absolutely supports that.
I personally have 15 years experience. There are lots of other HCAs out there with many, many years of experience that are highly, highly skilled, that can't advance for possibly the same reason as myself. Money, can't afford it. You're losing loads of people who could qualify as nurses. You're losing that experience and that passion.
Nikki has really sort of excelled in bringing the enthusiasm to it. She's made it her own.
You have to kind of fit your studying in, placement life, your family, and even though it's exhausting, you get tired, to become a mental health nurse, to be qualified finally and have what I've always wanted, that's what drives me, that's what keeps me going. I never thought I would have this opportunity, and being a nursing associate gives me this opportunity.